ABA Services, making a difference in children's lives.
Welcome to CollabTalk. I am Alicia, the founder of Collaborative ABA Services, where we are providing a new series of talks with our interdisciplinary team to talk about autism and everything in between, to provide information and resources to our community. To start off with our talk series, we're going to introduce our wonderful team members here at Collaborative.
My name is Katie. I'm an occupational therapist.
My name is Meg. I'm a registered behavior technician.
I'm Brianna, and I'm the clinical program supervisor, and I'm a BCPA.
Hi, my name's Alyssa. I'm the licensed social worker.
And we're going to talk more about what autism is, as well as signs and symptoms, and how can families get a diagnosis. So to start off with autism is a neurodevelopmental disorder that is characterized by deficits in language communication and also restricted and repetitive behaviors. According to statistics and data, there's 1 in 31 children here in the United States that are diagnosed with autism. Prior to this new recent development, the numbers of statistics was 1 in 36. So now we're noticing that there is an increase in the prevalence of autism. Team, why do you think that there is a sudden increase in this prevalence in autism?
I think a lot of it has to do with education and awareness. I feel like now that there are more comprehensive diagnostic techniques, that people are more aware of it, people are bringing their children to get tested. I feel like the prevalence has always been where it is, but now people know more about it.
Yeah, and I think it's grown in the last, maybe 5 to 10 years, the prevalence of learning what autism is and what the signs are, because a lot of people just weren't educated. I think it just deals with education and being aware and it being more socially talked about too.
Yeah, because when you said 1 in 36, I forgot that 5 years ago it was 1 in 70, there was 1 in 100, so it's slowly become smaller because people become more aware. It's very prevalent.
So some of the signs and symptoms to look for in autism, which everyone might not be aware of, may not always be, I know the number 1 sign is eye contact, but there's more to that diagnosis than a child not having eye contact. Some examples are struggles with appropriate space and boundaries, gives unrelated answers to questions, difficulties making friends, lining up toys or objects, and also being upset with minor changes. Is there any other signs and symptoms that you guys feel that families and other community providers should know to look for?
I think one big one is when they don't respond to their name or fixation on certain objects, colors, patterns.
And becoming upset with those, some of those fixations are kind of common with typical children, but becoming upset when those fixations or those patterns are interrupted, that's a huge sign as well.
Schedules are a big one.
Emotionally dysregulated. Like Bree said, it's kind of common with young kids to get upset when things are not how they want it to be, but I think kids that have a diagnosis, they get very emotionally dysregulated.
And OT, a lot we talk about the size of the problem, right? And I have kids that have a reaction like their house is on fire to I couldn't find all of the blocks to set it up for making it a perfect rainbow. So those things kind of get disproportionately kind of out of whack. In OT, a lot we see a lot of sensory issues, so sensory sensitivities to clothing, sounds, lights, having a really tricky time calming down for bedtime. So sometimes just the way that they manage their emotions and how they handle the world, it's always everything's bigger, brighter, louder. It's that book, right? Extremely loud and incredibly close. That sort of kind of sensation is a lot of what the children I work with, if they have the language, describe it feeling like. It's just everything's too much.
And so for families or parents, providers that are working with a child and they're noticing some of these signs or symptoms, what are the next steps to help them determine if they have this diagnosis? I know the first thing that I would say, and also working with children on the spectrum, is finding out from their insurance provider what are the requirements of the autism diagnosis, because a lot of people don't know that different insurances allow different qualified providers. And for example, some insurances may have specific requirements. So some insurances may allow licensed physicians or pediatricians to give a diagnosis of autism, licensed psychiatrists or licensed clinical social workers, or even a child neurologist. What are some other resources or information besides also reaching out to their insurance to find out who can give a diagnosis? What are some other resources that families can do to move forward if they see signs and symptoms?
I think the biggest one is talking to their pediatrician, especially when they're so young. Getting that ball rolling is talking to the pediatrician, sharing some of their concerns, because the pediatrician can always kind of guide you in which direction you should be going.
Mm-hmm.
And I think usually they would connect you to birth to 3 if the child is under 3 years old, which is also a really good step.
And like you said, with insurance, that's really big because some insurance require the referral from a pediatrician, where others you could just approach a birth to 3 service provider on your own.
Right.
And I think that's the biggest thing too, is that depending on the age of the child, the symptoms might be not necessarily different, but what is more prevalent will change.
Right.
Like I've had kids I've worked with that they come in and they're 2, 3, 4, 5, and say the emotional things are way bigger, because at that age, if you think about what's really important to a 3-year-old, a 4-year-old, is very different than what's focused for, say, a 6 or a 7-year-old. So sometimes just parents bringing up their concerns to their pediatrician, looking for services, looking for supports, or trying to find what is the best kind of avenue. It might change depending on their age. So starting earlier is a great way to kind of figure out if that's the best path for their child.
Right, because birth to 3 is so individualized. They create the IFSP, the Individualized Family Support Plan. So it is very individualized. It's not like a one-stop shop, and they can kind of direct you in to the services that you need. Like some children will qualify for speech or OT, PT,
Right.
all of those services.
Yeah.
I've had experiences with some pediatricians don't maybe see the concerns that families see due to whatever reason. So they can always contact Birth to 3 on their own, which going to like the Birth to 3 website, depending on where you're located, or some states have like a 211 number that you can call to like get directly connected to a Birth to 3. So I think that's another avenue if your pediatrician maybe isn't on board, but you still have a lot of concerns.
Yeah.
So I guess the next question is, so we're talking more about the children that might be under the age of 3. How about a family or, a parent or a provider that is working with a kid that is over the age of 3? And say, like you were mentioning, like with 211, would you say like for an older child that families can also call 211 to also still look for autism diagnosis as well?
Yes, definitely.
I think that it's more prevalent or more common for younger children to get, the kind of the ball rolling. But if you are, looking and finding that, I'm doing some, I've had parents too, they like do more research and they're like, I saw this checklist, or I saw this TikTok video, or I saw something and it made me, my kids kind of like that. I didn't really think about that.
Yeah.
So like you mentioned, Alicia, you can get the 211 support or services really anytime. And you mentioned too, like about additional supports for insurance. One of the things that families may or not know or understand is that you can get birth to 3 support and outpatient therapists at the same time, because one of them is through your state or through funding, and then the other one is through your insurance. So I have children that come to me that don't have a formalized autism diagnosis, but they're showing a lot of the signs and symptoms, and they get support through outpatient therapy in the process while they're going through that journey.
And I think following up with what Katie was saying is, typically when kids are younger, they're getting those services, right? But it's important to know that children on the spectrum, it's called a spectrum for a reason, right? So while one child may be lower on the spectrum, another child could be higher on the spectrum and could have maybe fell through the cracks, so to speak, because the parent saw a typical, childhood development, and they were communicating and they went to school and things of that nature. So they can be older, and as they get older, those social interactions may become a little bit harder, and reaching out to the resources like 211, having that conversation.
That makes me think too about the early signs and symptoms. Like there is such thing as regression. You might meet all the milestones getting up to that 3-year age, and then as they hit preschool age, all of a sudden potty training is not what it used to be, or speech, and the repetitive behaviors increase or become prevalent, and it wasn't happening up until that age. So the regression and the signs being prevalent later.
And that's kind of what you mentioned too, Alicia. It's a neurodevelopmental challenge, so it shows it's kind of like it shows its true colors through development. It's not like an injury or an illness. It just kind of like as you progress and as a child ages, that's kind of where it shows.
You guys all bring up some very valid points, and I think another resource that a lot of families may not know is Autism Speaks. And actually it's a resource not only for families but also providers that are looking to get some more information. It's autism specific resource website, and they also have a phone number. They do have what they call Autism Navigators, which is kind of like a 211, but it's specifically to support individuals with autism with accessing resources as well, and it is nationwide. So that's also a great place to start as well, looking up for resources and information for providers as well. Thank you guys so much for your time, and thank you for being with us talking about autism for this segment. We look forward to providing more information about different topics. If there's something pressing that you would like us to discuss, definitely send us a comment and we'll be happy to review it. And also, if you also like our content, please like and subscribe. Thank you.
Thank you.
Thanks.
CollabTalk is a copyright of Collaborative ABA Services, making a difference in children's lives.